collaboration blends creativity, tech, and medicine in the most innovative way. Dr. Patrick Thomas and Stephen Christian will unpack how XR platforms, 3D modeling, and gamified learning empower diverse patients and families to understand complex health journeys. Stephen Christian is a Unity certified developer, AR artist, and founder of Iltovia Studios, where he uses immersive technology to empower Black and Brown communities. As an instructional design consultant for Unity Technologies, he teaches non-tech creators how to harness AR for storytelling and innovation. Dr. Patrick B. Thomas is an award-winning pediatric surgeon and medical director of innovation at Children's Nebraska, where he leads advancements in AI, robotics, and XR to transform patient care. As founder of Surgeon Innovative Solutions, he pioneers immersive technologies like XR platforms and 3D modeling to enhance health literacy, engagement, and surgical education. Please welcome Stephen Christian and Dr. Patrick Thomas.
How's everybody doing? Good. You guys hear me okay? Oh, well, yeah. So today we're going to be talking about Black imagination in health technology. And we're sort of going to kind of start by talking about our journeys. I wonder if we can get, there you go. So, you know, on this agenda, because we always like to be organized, we're scientists here, we're professionals. So just sort of set the stage is we're going to sort of give a deeper introduction of who we are and what we do. And then from there, we're going to start to define sort of the philosophy by which, you know, both of us sort of subscribe to, and hopefully make those connections to probably a lot of stuff you guys are doing already. And then from there, you guys will kind of see the, you know, kind of work and, you know, just sort of see what it looks like from start to finish in the journey and why we do the things that we do. And then we'll like include it, and then we'll open up to questions because people tend to have questions, and we're happy to just, you know, just give more insights and help you guys along the way. And so, you know, as I said, I'm Stephen Christian. I'm a MD, PhD. I want to be a candidate in integrated neuroscience. I retired from playing Division I college football. I had 2 hip reconstructive surgeries along the way. I was stubborn and hard-headed, and so after my second surgery, instead of my school wanting to medical disqualify me, I ended up transferring to a better school and starting for another 2 years in the Pac-12 at Oregon State. And then when I finished that, I decided to found a creative studio. One, because I needed to get a job, and they weren't hiring people that were 6'1", 215, 6% body fat that had no work experience. And so you sort of, you know, you have to kind of create your opportunities. And that's when I got into like animation, book publishing, and you know, just being in the freelance space. And then along the way, you know, you make stuff that people enjoy, and then people want to hire you, like billion-dollar tech companies, and just for putting stuff on the internet. And so as I got into medical school, I started to see a lot of overlap in what I'm able to do when we create, and you know, provide opportunities for other people to do the same. So, let's see. Okay. There we go.
Hey everybody, so my name is Patrick Thomas. I'm a pediatric surgeon, clinical informaticist, and that's what I do. But who I am is a physician that loves science, loves technology, loves to solve problems. And I'll delve into it a little bit later, but that comes from very personal family experiences, which helped me to see gaps in healthcare that existed at the time and still unfortunately exist today. So I'm super passionate about robotics, artificial intelligence, XR technologies, and all these 21st century tools that are available to us. And unfortunately, in medicine, these tools are not necessarily being utilized to the extent that I think that they should be. So we'll talk a little bit about the journey of what it takes to go from medical school to become surgeon, and then what that educational experience is like, and what I hope will be able to change and influence moving forward. I'm a big proponent of using your imagination, and as I'll just have everybody do this for a moment. So everybody close your eyes for a moment, and I want you to imagine something that brings you peace. I want you to imagine something that brings you joy. I want you to imagine something that brings you frustration. And then I want you to imagine creating solutions to bring you joy and peace. So we're gonna dialogue, and we're gonna flow, and we're really gonna have a meaningful conversation to talk about these different elements.
And so before we get anything, we kind of have to lay some ground rules, like what we're actually talking about here, right? Because we're in the tech space, we're in the healthcare space. There's a lot of buzzwords, a lot of stuff that means stuff, and there's a lot of overlap in those meanings. And we try to, place our own meanings on them, but we have to be able to communicate in an effective way. That's having, basic understanding, right? So when we're defining Black creativity, it means something very specific. You can have your own twist on it, but we should be talking the same language here, right? And so hopefully by the end of this, when somebody mentions Black creativity, you're thinking a very specific thing from it. And so I like to start with definitions. And so just sort of using, based off of the title, just the definition of imagination. And hopefully that sort of lays the groundwork for what we're talking about. So the definition of imagination is the mental faculty of forming images and concepts of things not present to the senses, the human senses, or of combining past experiences in new ways, right? So something that is intangible, it's an idea. And if it's not an idea, then it's something that comes from our lived experience. So we'll just sort of use that as the foundation for it, okay?
So when we talk about creativity, it's important to kind of think about what does creativity mean to you? So again, just going into definitions just so I have a framework to build upon, right? It's not something that's abstract, but it should be a tool. As a surgeon, there's a variety of tools that are usually operating to get a surgical procedure done. So it's a tool that we use to solve problems, right? And from when we think about healthcare, it should be a tool that we're using to solve problems that the patients face and the ecosystem that wraps around the patients. And that's grandma, mom, auntie, cousin, sister, whomever's in that healthcare journey. When you're taking care of the patient, you're also taking care of everybody that wraps their arms around them. As a doctor that works on kids, right? I have to communicate with the children in creative ways. And also have to communicate that message in the hopes of what I like to do to the entire family, where they come on board and they get it, and we're all around.
Like when it hits, and we all feel it. And when it doesn't, you walk away with something that is probably not the most comfortable experience that you want to keep living. And so creativity, especially sort of that lived experience of a Black person, by default, us having a Black experience in America and us being creative, we have to look at it in a particular way, right? And there's cultural aspects of it that we can't run away from. And so for me, one of the things that's been really helpful is being able to, at least coming from a non-technical, being in athletics, going into the arts, and then coming into medicine. There's a lot of stuff that I did just as a creative that I sort of, that drove me to create the stuff that I needed to create, right? And a lot of it is because, you want to create the things that you don't see in the world that speak to your values. And then you sort of build community around that. So there's another concept called Afrofuturism, which is essentially looking at things through an African cultural lens, right? So you, as your culture, you see things through that culture because certain things mean certain things, and certain terms mean certain terms, and you wouldn't do certain things in certain contexts, right? And so, but you're doing that from the perspective of being able to explore and wonder and lean into the curious nature that we all have. But how you start, where you go from there. right? Like it's blank slate, there's many options. What can you anchor to get you forward? And it's this, and it's really just this power of like, what if? If you just ask and present it with a situation, you know, what sparks the moment to explore? It's like, what if this? What if that? Right? And so through a lot of my work, you know, it's really just like, give me a situation, and then I just say, okay, what if I could do this? What if I could explore this? What if I could tell this story? What if I could create this solution? What if this solution or this problem had a solution? Right? And just literally starting with that, just what if, and then you just finish it off, right? I'm getting one of these guys. If I change, okay. And so when I was at Oregon State, because again, you know, I was playing football at Oregon State, and I had the opportunity to get into a master's program in interdisciplinary studies. Back then, it was like probably 2011, 2012, 2013. I didn't know what the heck that was, right? So I was like, okay, what am I going to school for? You know, I want to be one of those athletes that walk away with a degree that I just can't use, right? Just because I need to stay eligible. And so what it allowed me to do is really look at how to solve problems by taking all the things that you learn over your life, and then instead of putting them in boxes and you pull from those boxes, you sort of dump all those skills into, you know, a bucket. And if you need something that, you know, is a core tenet of art, then you pull from that, or design, or, you know, biology, whatever. It's all in service of the problem that you're trying to solve. And so even if it's unconventional in that industry, go across industries, it may be the saving grace. And so be able to look at things, you know, open-minded and pull what you need for you to you know, service the problem, right? And so then, you know, sort of as I've gone through sort of the art and design space, there's this concept called design thinking, where you have, you know, the driver of that curiosity, and then you have the, you know, all these skills that you have that you can pull from. But, you know, like you're faced with a blank slate and you have a problem right in the center of it. Where do you start to get that solution? Like, what is your framework, right? And so, you know, being able to look at things from a human-centered approach, it's real people having real problems, and they're coming to you for solutions. So you have to think about them in the center of that, because they're going to be the ones using it. If you don't think about them in the center of it, right, then you know, in the tech space, you have tech for tech. Right? And so you have these things that do great things, but like, why? Right? We all remember the age of the QR code. Nobody wanted to put a QR code on anything pre-pandemic. And then pandemic came around, and now if you're not putting a QR code on something, you just don't care. You don't try to make money, right? Because it's thinking about how people access things, and they don't want to read a whole bunch of stuff. They just want to get straight to the point. So there's a link. I got a phone. Boom, 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 right? So you got to start somewhere. You got to think about the people in the center of it, right? And so really framework. This is how I approach everything. Have an idea, and try to get straight to a prototype as quickly as possible. Literally get that idea on paper, and then use whatever tools you need to manifest that and make it tangible, right? If I can touch it, I can see it, it's real. And then from there, you try to iterate on it until it works in any situation. So you'll sort of see that process, but that's what it is. That's the sauce.
And then let's talk about patient-centered care. I got a question for everybody, and I just want you to just shout it out from wherever you are. When a doctor walks into the room to see you, or to see your loved one, or your kiddo, if you have kids, what's the first question that you've heard them say? Anybody? What's going on? What brings you here? How you feeling? That's good. What else? Personal experience, your personal experience.
How are you?
How are you doing today? So if they're asking questions like that, those are some really cool doctors that are actually assessing your feelings, right? How many physicians have asked you, you know, how can I help you? How many? 0. I can't see it because of the lights. So if people raise their hands and somebody counts up, I've heard 0. And I'm not seeing no hands out there at all, right? I saw 1, okay. So I would suggest to you that your provider should be asking you, how can I help you? Because that's the first opportunity for them to actually hear what's going on and what your concerns are, and for them to actively listen. And when they're actively listening, that's when you can create a care plan wrapped around what you're concerned about and what you're understanding of what's going on. So patient-centered care is a buzzword, but it's a phrase that I like to have meaning. I want meat to be on those bones. So when you're interacting with your healthcare providers, maybe you should ask them, how can you help them? To help them reset their mindset. Wait a minute, why are they asking me that? And why am I not doing that? So all of that is to say that, patient-centered care is 100% patient-centered design. And if you're not asking, how can I help you, you're missing valuable opportunities to create impact and actually to address why they're there to see you in the first place. So if a takeaway for you all is challenge your physicians, your nurses, anybody that's taking care of one of your family members or you, so really figure out how you're doing and what you want. And ask them, how can I help you? And kind of watch the reaction. They're not going to know how to take what's going on. But then hopefully that will help them to think, well, man, if they ask me that they care a different kind of way. And hopefully they'll look at you and care a different type of way. And use their medical knowledge and training to actually deliver the type of patient-centered care that you need. Because what everybody needs in here right now, if I say peace or joy or healing, everybody's got completely different answers.
I get this. Okay. So I've learned, don't use your thumb, use your index finger, because get that angle, problem solution. Okay, so ultimately, right, like, to be somebody that's, Black and in healthcare technology, there's, it's not devoid of culture, it's not devoid of creativity, right? Especially from both of our standpoints, like, no precedent for a lot of stuff that we're doing. And so there's no precedent, there's no data, like, you gotta do something. And so what drives you, like what tenets do you pull from so that you can actually get the problem, solved? And ultimately you kind of just gotta make it up. And that's okay. And you have to be okay with it being okay. You have to be okay with being able to pull from your lived experience as a Black person, getting into that solution, because when you're in those meetings and you're being like, hey, I got to do this IRB protocol, we have all this money on the line. Why did you make this decision that we're going to publish in Nature? You got to be like, well, I was walking down the street, I met somebody that approached the solution this way, and it stuck with me. And I've always seen it through the way that person chose to solve that problem. And that core tenet led me to come to this solution. I can do all the lit review I need to, but ultimately, if I didn't walk down that street, I probably would have never gotten to this solution 10 years down the road, right? And that matters. Just at this point now, we can get objective data to retroactively show why that was a great decision. And I think that's one of the things that is, I'm doing in my work, he's doing in his work, but that is the opportunity that we all have now, is to take those cultural stories and actually add objective data to it. It's up to us to do that. But ultimately, how do you get to that point, right? I'm a Black person in America, and being in the health and tech space, I have to be creative in order to get through to the career that I want to have. Just call spade a spade. And so, at least from my perspective, I'll sort of walk you through what that journey has been like. Essentially from me sort of being able to express myself and how that has led to like my research stuff. And everything that you see thus far, it will literally build upon itself to the point where I feel like I'm doing the same thing every day, which is awesome. But for all intents and purposes, I'm letting in this here, this is what Black creativity and health tech looks like. And by the end of what I have to say, like, you will see it very clearly. Oops. I'm still in this. Okay, so I mentioned I play football. I ended up having hip surgery and getting into creating comics and cartoons. And one of the reasons why is because not only did I have hip surgery, but my Xbox got stolen. I got robbed and stuff. And I was living in Hawaii, right? And so I was like stuck in a wheelchair. Kid you not, I was stuck in a wheelchair in my room. And this was back in, 2011. And so the internet really wasn't a thing. I wasn't doom scrolling or nothing. Couldn't play Madden. And so I was like, dude, like, how do I fill in that void that college football took up, which is a large portion of my day, my life? And so I was like, well, what if I just like got into storytelling? I was a big fan of Boondocks. Back when Borders was a thing, I ended up getting like a webcomics book. And I just sort of studied that and just created stuff, put stuff on the internet. And through that process, I was able to, through that process, I think I wrote and illustrated like over 1,000 pages through that journey. So that's a lot of pages. But one of the things that it did for me is it allowed me to really work through the process of what it looks like to not be a football player. That identity crisis that we all feel. And so for me, when my football ended, it was just like, how do I pivot? How do I pivot as somebody that is driven and young and wants to do something, but like my world is not what it is before, right? So going back to that concept of Afrofuturism, that what if? And so, just sort of what if I could show the growth of a Black character, across 1,000 pages, what does that look like? And through that process, I learned a lot about myself, and I gained a whole bunch of skills, but I also learned about the power of resilience and what that literally looks like in the middle of it and on the pages. And so from there, I was like, okay, this creative thing is kind of cool. Going to comic conventions, all that. But then I found that, as I wanted to get into animation, there were limitations. And those limitations were and you could just walk across the room or just across literally it's an industry problem. When an animator goes to a comic convention, they're able to sell comics, stickers, all those things. They cannot sell animation because animation is, as great as it is, it's very inaccessible for consumers, for creators, for everybody. And so you sort of have to discount your creativity in order to make money, because that's how a lot of people or creators make money. And so I was just like, what does it look like for me to sell animation at a comic convention? And, how can I create animated shows that don't exist on YouTube, but exist in books, right? And so through that, I learned about Unity and augmented reality, and literally using technology to place animation that I would normally put on YouTube inside the book to where you were watching the book. Like, I literally make books that you watch. And anybody that's seen my work, MS does exactly what it does. And it is the fun, it's the best experience that I can part ways with people. But it really just started with that what if. And so then, as I got into medical school and started to go through the rigmarole of, just being a creative and non-traditional student in medicine, I realized that medicine is storytelling, but also medicine doesn't always tell stories. Like, medicine is wild, and that's okay, right? But looking at the graphics, like the top is what we're given. And for me, I was like, there has to be a better way. Like, this stuff is text heavy, it's antiquated. In the age of TikTok, how am I supposed to, I'm gonna remember stuff from TikTok before I remember stuff from the book. I need stuff from the book because I gotta pass this exam, so I don't get kicked out of school, right? And so it's a real problem, right? And one of the things that most people see is that, especially black students in the first couple of years of medical school, they struggle because it's not what they're used to. It's not how they look at life and navigate life, but they have to get through it in order to be a doctor. That was I struggled, right? And so I just, looked at it and said, what if I made medical education more visual? That's it. And so, I'm an animator, I do a lot of stuff. I have 1,000 pages in my note, right? So just literally taking the top part and and then just, drafting on a page and then just eating it and teaching about these mechanisms that we need to know. That, a mechanism is just, a beginning, middle, and end. And that's just a plot structure. That's all it is. Talk about problems and solutions. And so from there, once I got through the board exam thing, then I was just like, man, I need to do stress. And so one of the fun...
I got to pause. I just can't let say the board exam thing. That test is stressful. If you know any doctor whatsoever, and you go back to talking about the step exams, we all cringe. It's a necessary step to get through. And, I just can't let you sit. I can't let him not, I need y'all to understand the impact of the stress that has. If you do not pass those step exams, you cannot become a physician. These are major milestone hurdles. If you meet any physician that said, oh, I love the step exams and stuff like that, run, because they're mine.
Okay, so to that point, it was so stressful, I started making plushies. So after, and this is literally a true story. One of my board exam questions was about this bacteria called, it was about acne. So a patient comes in, because they're all clinical presentations, patient comes in, they pretty much have cystic acne, and I had to know what the bacteria was called, right? So the bacteria was called Cutibacterium acnes, right? And so I was like, man, I'm stressed out and all that, but that resonated with me, right? I remembered it. And so I looked it up, I was like, how do you say this? They're like, oh, Cutibacterium acnes. So I was like, Cutibacterium? Cootie? And so then I started to go down and be like, has this always been a thing? I looked in First Aid is a big book. Cutibacterium acnes is right there. Cystic acne, acne vulgaris. And then I was like, okay, I'm a researcher. I have access to PubMed. Looked it up, 2016. It was like, yeah, we renamed it from Propionobacterium acnes or P. acnes to C. acnes, which is Cutibacterium acnes. One of them was it's a cutaneous form of it. So I was like, okay. And then it was another note of and there's some cultural aspects that we want to lean into. I was like, these will organize it. we're going to give all these kids cooties. just because. And so one of the fun things is, Cutibacterium acnes is the bacteria that gets into your hair follicles, and then you have the immune response, and then you develop comedones or pimples, right? And so, plain language, right? Plain language. When somebody has a pimple, they have a cootie infection. I need to know it for my board exam, so now you guys know it all. And so what I thought about is okay, this is science, right? This is science as a storyteller. This is I can't make a better premise to the story, right? So what if, I turn something that is, very real that I need to know into an adventure, something that's a comic book, right? So something quirky, right? And at the end of the day, something about cooties, microbiology, right? If you read in a textbook, it's going to be dense and inaccessible. But we don't know about cooties, right? So then how can I lean into that? Right? And so I thought it would be fun to just make a story about there being a cootie outbreak on an island. And my main character, Roscoe, he's, in my series, he goes missing. And literally his stuffed animal is Nimbus, and he comes to life magically because why not? And they go on this adventure to uncover the mysteries of the outbreak and ultimately save, the island from the cootie outbreak, right? And so the island is metaphor for the skin. The hair follicles, the trees are metaphors for hair follicles. The outbreak is a metaphor for puberty, right? And what they do in the story to address the cootie outbreak is what you do to address what happens when you have puberty and you have acne, right? So we don't end up with scars on our faces. And ultimately, Roscoe is black. He's missing. They have to save him. The story is about saving black skin. And so through that process, you get people involved in a way to save black skin through what Nimbus and the cootie catchers do in it, right? Empirically based, all that stuff works, but it doesn't need to feel like I'm preaching to you. It's an adventure, right? And I know that because I tell stories. And like I said, medicine is going to tell stories. And so as a creator, like this, I'm loving this goal right now. And so then we get into sort of the crazy stuff that I'm doing, where, taking those things, augmented reality, animation, all that, you've heard the term real-time rendering, you're rendering animation. That's what we're talking about, right? And so taking these games tools and being able to use sensors that are measuring at 90 to 100 hertz a second, VR headsets, face tracking, all that. And I just thought, what if, I could take consumer-ready virtual reality devices and being able to take those objective feelings that we have. I feel sad, I'm frightened, I'm dizzy, and be able to explore biomarkers, non-invasive biomarkers, for all of these things that we feel, so that we have objective data to the stories that we actually tell, right? And if we can get that objective data, then it gives us a lot more validity in terms of our lived experiences, because we have the data to show, right? So you can just go to Walmart, get this thing, load up the free software, and then collect all the data, and boom, what we're talking about, right? But it took me as a creator, I see that clearly. And I realized being in the spaces I'm in, nobody sees that. That is wild, right? But the perfect application is, we all love football. If you're, my family's from Arkansas, so if you're in Arkansas, on a football field, in the middle of nowhere, and your kid is, practicing or whatever, they have a concussion, how do we know if they're ready to come back to the field? We don't. So those are real issues that we can address with it. But, it all starts from, being able to just, I play games and create stuff, and I'm able to do that with it.
So, let's talk about, research to planning to bedside. So I love this picture, and the gentleman that's sitting down is a exceptional fetal surgeon, pediatric surgeon that I was fortunate to train under, Dr. William at Texas Children's. So it's good to be back in Houston because I trained at Texas Children's finished in 2007, started my career as a pediatric surgeon. So I operate on babies that are just born to these 19, 20-year-olds that come in with their mom saying, baby's got appendicitis and they got more hair and more facial hair, more hair than I do. I'm looking at this grown man, this grown woman saying, this is an adult. But the mom says, that's my baby. I'm like, okay, I got it. So what I love about this picture is that he came to Children's, Nebraska, and I'm showing him some of the work that I do using virtual reality for surgical planning. And I had the opportunity to teach the teacher and share my expression of where we should be going, where we should be moving as surgeons. It blows my mind that it is not standard of care and standard of practice for surgeons to be doing very complicated operations, not doing it in a simulated environment first. So the mantra of surgery is see one, do one, teach one. Well, that means you get more reps, which means you need more volume. And if you're in a place that's high volume, highly trained, then you pick up the skill set. But then the other thing that's important is the translation of that knowledge and information to the other learners, the other surgeons that are coming behind you. So I postulate that, hey, this is the technology that we should be using fundamentally like a stethoscope. And I'll touch base on this a little bit later, but it's not only used for surgical planning. You can use this to design experiences where you can actually help with postoperative pain and decreasing anxiety. And when you think about those opportunities in our communities where pain and anxiety is like, and different ways that we can create scenarios to help with that, I just want you to put that in the back of your mind. We're going to come back and talk about imagination. And then to the right, I'm using an ultrasound with a headset on that has basically a map, an ultrasound map of what the veins look like in that block of tissue. And this is at St. Jude's Children's Hospital. Again, based upon some of the work that I was doing in Children's, Nebraska, that led to how can we really use advanced visualization in taking care of children with tumors, and what other tools should we be using as clinicians. So I want to pause and just kind of, nod to imagination and two people that kind of inspire me. One is Dr. Patricia Powell. Does anybody in the room know who she is? Anybody? Shout it out. That's a no.
Yeah.
Who said yes? Who is she? Tell me what she did in your own words. So what happened? She actually is a ophthalmologist. Now, one of my neurosurgery friends told me, I'm not sure if you know this, that the eye is evidently part of the brain. So I'm going to have to do my neurosurgery on that. That's just too much mental gymnastics for me to jump into. But pioneer in ophthalmology and actually helped create the laser that you're using for cataracts, right? So, but she's standing on a foundation of like knowledge that is unparalleled, right? But she says the limits of science are not the limits of imagination. So this is somebody that's so creative that helps create a laser for cataract surgeries and stuff like that, and live her life as an innovator, right? Somebody that we all should know, right, from a Black history perspective. It also talks about the power of imagination. And then Dr. Anna Howard is a roboticist, and she's the dean of the engineering school at the Ohio State University. And I'm putting some respect on the Ohio State University because my medical mother trained there, and that's what she taught me to say whenever we reference the Ohio State University. I'm a Duke University guy, but I'm still put some respect in the name. However, let's look at this up. Innovation happens when we bring together diverse perspectives and imagine beyond today's limitations, right? And as we think about the landscape that we're in right now, there are plenty of things that take away from the power of your imagination. And when you think about artificial intelligence, it's like, where do I begin? How do I wrap my hands around this? Well, I'm going to wait till somebody figures it out, or I can understand it better. You know, we've got to wrangle with it now. We've got to experiment with it now. Wherever you are, whatever you're doing, collaborate with people. But this is the opportunity for us to imprint in what's being created our DNA, our experiences, making sure the things that are designed are relevant to us and for us. So one of my other favorite quotes from Einstein is, imagination is more important than knowledge. I'm a pediatric surgeon. There's a lot of knowledge that I've acquired over the years, but one of the things that I'm most proud of is that I lean into my imagination. And medical education doesn't allow you to be a creative and use your imagination. A lot of stuff is performative and rigid in what you're actually able to do to get to the next level and become who you want to become. So this picture I love for a couple of reasons. One, there's a beautiful brown baby that you're seeing. And how many of us have ever seen ourselves in medical illustrations that give us a sense of like belonging or hope? Hey, that makes sense. Now, when we jump down to the young kid that's got the arms flexed like this with the mask on, I love that because that's a smile. The picture I love the most in there is my big brother that you're seeing as a baby. Let's go to the next page. So before I was born, 2 years of age, my brother Paul was in an accident, and the ambulance showed up with no oxygen. So anybody that is medically related understands what cerebral palsy is. My brother basically had an anoxic brain injury and went from a normal, healthy baby boy to having cerebral palsy, having seizures, wheelchair dependent, not being able to speak with words like I'm using right now. And this is in Durham, North Carolina, and this is the biggest, most important children's hospital to me in the world. This is Lennox Baker Children's Hospital. This is the first time I saw a hospital with services wrapped around my brother that was in a wheelchair. They had a ramp that you could actually get into the building instead of my parents carrying me upstairs. Now this story is funny for me, and this is for me, but when we had to drive from Fort Bragg, North Carolina, to Durham, North Carolina, we had to leave our basset hound, Charlie Brown, back behind. I didn't like that. So my mom and dad packed up all of us, including my brother, and we went to this hospital. And it was a good day when all the providers were there to give my brother what he needed. But if not, we had to spend the night, eat pizza, and then come back the next day. My parents never let me feel the weight of that, and I truly appreciate that today. But when we're talking about designing healthcare experiences, there are still plenty of gaps that need to be filled, and many more minds that need to come to the table to create solutions. So, the 21st Century Cures Act was passed, and in the 21st Century Cures Act that was passed, it states that everybody has access to their medical information, all the notes, everything. But the problem with that is that just because you have access to information doesn't mean it's interpretable. It doesn't mean that you understand what those lab reports mean. And more people are becoming aware to use generative AI solutions to kind of say, hey, break this down to me in a way that I can understand it on an 8th grade level. Or break this down in a way that I can understand I'm a jazz musician and make this like a riff. Or break this down where I can understand it as if I'm creating a recipe. So one of the things that we have to think about in this ecosystem that we're in now, we've got opportunities to build digital health solutions. So as you look at the different opportunities that are there, figure out where you are. If you're a developer, right? How are we creating new technologies? How do we promote new technologies? How do we empower patients? How do we get them to understand what's going on? So again, it goes back to human-centered design. And we talked a little bit about it. I want to make sure we've got time for questions at the end. But my question to you is, what are you designing in your mind? And why aren't you bringing things to the table? And what solutions do you think would help your family member or help yourself? You know, when you think about the gaps that we have in healthcare and your voice being heard, you being silent is not going to make somebody run to you. We need to be creating platforms and experiences where we can collectively raise our voices and say, hey, we have issues with maternal health, right? How can we address that? Hey, we have problems with kids that have asthma or peanut allergies. How do we address that? But from a surgical perspective, how do I break down and help you understand what it means to have a surgical problem that I need to operate? So here is my takeaway message for you. Combining artificial intelligence and extended reality is the future. And we need to go from, in my tribe, what we call augmented intelligence to creating augmented impact. So wherever you are in your journey, whatever industry that you're in, we have to use these tools and we have to build these tools together. I believe this is the new hip hop. And I think that this being the new hip hop is our opportunity to spread our cultural influence around the world and elevate health for everybody, and especially in our communities. So I'm a pediatric surgeon. I do robotic surgery. I use virtual reality to help me do surgical planning and simulations before I go into the operating room. I believe that this is the future and how we need to use these tools. And I'm teaching the next generation of surgeons and medical students to use these tools in a meaningful way. And I would just say that have the courage to dream big. Please have the courage to use your imagination to create the things that we need. So here's some questions that I came up with for you all to kind of ponder. And this for some self-reflection. Thank you for the opportunity to be here with you all and we can answer questions that you have.
Yeah. So if anybody has any questions, raise your hand, I guess, and somebody will do the mic.
Hi, so my question is, I'm a nurse and I do post-operative recovery services. So with my business, I am looking for ways to connect the AI experience or something like this with my patients for their pain and just give them something to do really because, they're just sitting in the bed. So as a healthcare professional, how do I gain access or knowledge base to know how to create the AI system or whatever I'm trying to create.
I'll say very succinctly, there are a number of different companies that are being created right now where they can do different activities to help your patient relax. I use virtual reality for my patients after surgery, to get them to be in a calm, relaxing environment, to take deep breaths. There's ways that it alters the brain's perception of pain, so there's decreased use of narcotics. So there's different companies that are out there. My call to action would be, we need to create our version of what those experiences look like. I had you imagine what peace, what joy looked like at the beginning. And when you close your eyes, everybody created different stories. These are just tools that we can bring the stories to life. Steve, you want to touch base on just the actual tools in the toolbox?
Yeah, so let me see. I would say you got an iPad, Procreate, Polycam, and Nomad Sculpt for 2D illustration, 3D modeling stuff, or stuff that you have around the house to turn them into digital twins. And then other tools with Blender, Unity, VS Code, and Clip Studio. Essentially, there's a lot of free tools out there, and a lot of free things that you can just learn on the internet. Unity was used for Pokemon Go and Angry Birds. Blender is used for multi-million-dollar movies. Visual Studio Code is how you can write Python code to build your own AI models. Clip Studio Paint is what pretty much every company uses for making comic books, right? So.
Yeah,
Like, what you want. So it's just up to you to just know how to do it. And then you'll figure out how it can be used. That's ultimately that's how it is, right? And so that's our time. Again, we'll answer some more questions.
Yeah, just add on to that real quick. The other thing that I would say is that the healthcare provider, get with somebody that's in that space that actually knows how to develop, that actually knows how to, for all the clinicians, partner with someone like Steve, right? And the reason why I say that is because you need a team to bring your ideas to life. And as a surgeon, this is as a surgeon, as a physician, as somebody that cares about my patients, as someone that's like sustaining the legacy of my brother and everything that he went, turning from into triumph. We've got to create these different solutions. We have to partner together to create meaningful needs and design solutions. So it takes a team. It's a team sport. So the practitioners, we typically think that we're the only ones that are out there trying to solve these problems. We've got to partner with people that know how to do it.
Yeah. So again, just appreciate your time. Appreciate being able to share the stage with you and just sort of share what we love to do on a day-to-day. And hopefully from this, more about foodies and ultimately, what it looks like to be a Black creator and be authentic in that space and be able to provide solutions. So,
Are cooties for sale?
They are for sale. But again, I'm Stephen Christian, tech innovator, web illustrator, and all that stuff. And
Patrick Thomas.
and we appreciate you for your time.
Thank you.